Endometriosis can feel like a battle. I've seen it glue organs together. Let's talk about treatment options. Hi, Dr. Brian here, retired gynecologist and founder of my health coaching program, Health Without Risk. Today, we're exploring more information on endometriosis, starting with the big question, what's the best way to treat it? Let's discuss my approaches and explore what this condition is and the options that you have.
1 in 10 women live with an invisible battle where their own body becomes the enemy. Sarah thought her pain was normal. Every month, she'd curl up on the floor, convinced this was just what being a woman meant. But then the pain started showing up uninvited, during work, on dates, even grocery shopping. Sharp, stabbing sensations that stole her breath. Friends called her dramatic. Doctors blamed stress. Yet deep inside her pelvis, something else was happening. Tiny pieces of tissue, like those lining her uterus, were growing where they didn't belong, on her ovaries, bladder, and behind her uterus. Each month, these rogue implants would swell and bead. But unlike a period, the blood had nowhere to go. It pooled, causing cysts and irritating organs, forming adhesions that glued her insides together. This wasn't in her head. This was endometriosis, where heavy bleeding is debilitating, and the dream of starting a family is clouded by infertility. Sarah's pain had a name, and finally, she wasn't alone.
Endometriosis affects about 15% of women during their reproductive years. It's when tissue like the uterine lining grows in places that it shouldn't, like on the pelvic lining or behind the uterus. This tissue can act like it's still in the uterus, bleeding during your period, which leads to heavy, painful periods or even infertility for about half of women. Symptoms can include agonizing menstrual cramps or pain during intimacy. It's tough and it's more than just bad periods. Endometriosis thrives on estrogen, the hormone produced by ovaries. That's why treatments often focus on controlling those estrogen levels or removing the tissue itself. But here's the catch. The only true cure is menopause, either naturally or through surgery like hysterectomy and removal of both ovaries. For many, that's a big step, especially if you're young or you want children. So we need options that work for you. Let's talk about those options. First, hormonal treatments like birth control pills can help by reducing estrogen production from the ovary, but they're not always enough, and they are in fact much more potent than natural estrogens that are in your ovary anyway. A stronger option is Lupron, a medication that puts you in a temporary reversible menopause-like state by lowering estrogen levels. It can shrink endometriosis lesions and ease pain, but it's not a walk in the park. Like side effects of hot flashes, that can happen. It's typically used for about 6 months, so you got to put up with that. Then there's surgery. Laparoscopic or robotic surgery can remove endometriosis lesions. They can be tricky. You have to get every bit of tissue, even the microscopic ones, or that tissue can come back. I once treated a patient in her 30s with severe pain. Her endometriosis had spread so much it glued her pelvic organs together, like a cancer that doesn't kill you, but it caused her so much suffering. We used Lupron in surgery with a bowel specialist to help her. It shows how complex endometriosis can really be. What's the best treatment? Well, that depends, like everything, on you. Your age, your symptoms, and your goals, like whether or not you want children, will help shape the plan. Some women manage with medication and lifestyle changes, others need surgery. It's about finding what fits your life. Always talk to your doctor to weigh all options and don't feel alone. Support groups and resources like the Endometriosis Foundation are there for you for your own research. As always, I recommend you explore your options and ask questions prior to making any definitive decision. Total hysterectomy and ovarian removal will eradicate endometriosis, but that choice is not for everybody. If you don't want a hysterectomy, find a minimally invasive surgeon like me. It can take more time and skill than a hysterectomy, but if that's your choice, that's what you deserve. Next, we'll dive into living with endometriosis and tips for managing it day to day. Drop your questions or experiences in the comments. I'd like to hear from you. Hit that like button and share this video. Remember to subscribe to or follow Health Without Risk, where we explore options for better health you may not hear from mainstream medicine. Stay strong, keep asking questions, and thanks for watching. Bye.